In 2011, the Catholic Archdiocese of Madang began an ambitious project in the heart of the Middle Ramu district, taking over health facilities in Josephstaal and surrounding areas. The Archdiocese implemented a 3-year rehabilitation and construction plan.
We had a transition period within which we were to try and manage Josephstaal as a whole. Within the 3-year transition period, we were successful in securing funding from OSAID through incentive fund.
The church spent 3.5 million kina in Australian aid money constructing more than 39 new buildings, including staff houses for medical workers. All this done under a 3-year agreement between the Catholic Church, the Madang provincial government and the Provincial Health Division.
The idea was to make Josephstaal become a referral site for 10 satellite facilities within the Middle Ramu district.
The project drew high-level Australian government attention. The opening of the Josephstaal Health Centre was attended by the Australian High Commissioner to PNG, Deborah Stokes. But when the interim agreement expired in 2013, the new agreement wasn't signed by the provincial government, who were responsible for the payment of salaries.
When I sent out the project officer for 6 weeks, he walked from one facility to the other, to the total of nine satellite facilities under Josephstaal, including Josephstaal area, and he felt really sorry. It's not a good story. People are dying, most of in which we can actually help, but because nobody's there and the supply of medicine was not very effective, they just felt hopeless.
Since 2013, except for the infrastructure development, we have not been able to improve or achieve what we wanted to do, simply because terms of the MOA that we entered into were not agreed to by our partners.
This afternoon, Madang's provincial administrator, Daniel Aloy, said at the time of the project, the provincial government didn't take into account the additional cost burden.
I think at the time when the facility was put in place, the sustainability of that facility was under-calculated, if I may put it that way. Now, I think when we were quick to get the facility in place, but our response on how we would sustain it, that was something that we did not calculate it very well.
He says the provincial government is expected to sign the agreement this quarter, putting an end to this outstanding issue.
At this moment, the agreement is on my table now as I'm speaking. It was given to me last week, and we are going back to review the agreement. And I think, in the history of institutions, once there is an institutional commitment, you will have to carry that on, after a while. But of course, after the review, I believe that there will be a better arrangement for us to carry that facility.
As part of an overall performance review, the Madang provincial government expects to spend time on Josephstaal as a topic of discussion. But again, funding will be given depending on cash flow from Waigani. Scott Waide, National EMTV News, Madang.